In this video, I will explain to you the basis of UDI-DI and what it's to be used for. So stay tuned for some valuable minutes. Hi, I'm Pontus Gedda. I am a medical device specialist that have worked in the notified body world for almost 7 years now. And you are watching a video that's part of my course Introduction to MDR, the Medical Device Regulation. Do you need a course certificate proving you know the MDR? Do consider my MDR online course that you can find on the link in the video description below, or visit medicaldevicehq.com and check out the MDR course or any of the other medical device courses we offer. Do you want to be notified when we publish more MDR or medical device related content? Do follow Medical Device HQ on LinkedIn, where we will post news about new content. Let's go for some action then. Sorry, but this is as much action as you will get. But if you don't see much action on the surface, rest assured there is a lot of things going on inside this database. And one of those things is the registration of the devices and their unique device identification number, the UDI. So let's start in that end. But before we do, I want to clarify the purpose of the UDI-DI. The main purpose of the UDI-DI is to enhance traceability, cooperation and transparency regarding medical devices in EU. The database will be huge considering all data that shall go into it. Therefore, it has been split up in 6 different modules with specific purposes. And here are the 6 different modules. You can also see them in text below this video. In this video, I will focus on module 1 and 2, but first, let me just describe the purpose of the other 4 modules. Module 3 in this list will mostly be used by the Commission, the competent authorities and the notified bodies, but parts of this module will be available to the public, like the actual certificates issued by the notified bodies for conformity assessment. And also this is where the SSC piece will be found. An interesting thing to mention here is that notified bodies that has refused certificates to a manufacturer, or where the manufacturer has terminated the conformity assessment for some reason, the affected notified body must report that to this part of UDI-DI so that others notified bodies are aware of the situation. Then module 4 in this list will be where the manufacturer applies, follow up and report on their clinical investigations. Here the manufacturers actually must disclose what they want to achieve with the clinical investigation before they start the clinical investigation. And if a clinical investigation is terminated for some reason, this shall also be reported here. And a lot of the data in this module will be accessible to the public. The Vigilance and PMS module is where the manufacturer needs to report any serious events with their devices, along with any field safety corrective measures. And that shall be done together with the related basic UDI-DI and UDI for those affected devices. Here, the trend reporting from the PMS system also needs to be uploaded. And this is also where to upload the PSURs for the manufacturers. The data in this module will only be partially available to the public. The last UDI-DI module in this list is the market surveillance module. This is primarily for the authorities to use for communication, but the market surveillance reports shall be made available to the public by the authorities for each member state here in this module. So, let's now dig into the 2 most applicable modules for the manufacturer, the modules for actor registration and the device registration module. Here we see an example of one of the modules. In this case, it's the public part of the actor registration module. To make a registration in this module or any other module, you first of all need to request a registration, and then you will obtain an EU login to be able to register information into UDI-DI. Below this video there is a link to European Commission guide on how to request registration to be able to input data into UDI-DI, as well as a link to the restricted part of UDI-DI where you register as an economic operator. But if you just want to search for information in UDAMED, you don't need a specific login. You find the link to the public parts of UDAMED under this video. And this is what the entry site for the restricted part of UDAMED looks like. And in yellow highlight, you can see a link to request the EU login needed to be able to access the restricted parts of the UDAMED and to do the actual registration of yourself as an economic operator and then later register your devices. Please see also a link below this video to a user guide for UDAMED. Then, when you have been approved and registered as an economic operator, except for distributors, you will receive your SRN. SRN is short for Single Registration Number. This will be your ID for all coming communication to UDAMED and also for you to identify you on certificates, DOCs, etc. And remember that when you register as a legal manufacturer or an authorized representative, you also need to state who is your PRRC, and this information will then be publicly available. Okay, back to where we started, the UDI and device registration module. As we concluded in the last lesson, all medical devices must have a UDI-DI on the UDI carrier, the label. And as you understand, all data related to a device will not be possible to fit on the UDI carrier. And this is where UDAMED comes into the picture. So, picturing this registration as kind of a flow where we can see it like this. Starting from the top, you have now obtained an SRN from the active registration module and can start to register devices. First thing to do is to assign a basic UDI-DI for the device or devices you want to register. And as you already know, the basic UDI-DI management shall be according to your QMS, and the actual basic UDI-DI code shall follow the nomenclature of your issuing entity. What data to include in the basic UDI-DI is found in a link below this video. The basic UDI-DI will now cover one or many UDI-DIs, and the UDI-DI shall always be on the UDI carrier. All this you must of course keep track of in your own QMS also. Then the actual device registration inside UDAMED can start. And remember, it is only the UDI-DI part of the UDI that gets into UDAMED. And once into the UDAMED device registration module, UDAMED will understand your SRN, but you also have to specify during device registration to what basic UDI-DI the devices you are registering belongs to. So now we are in the actual device registration module, and here we need to enter all the relevant data to the actual device corresponding to that specific UDI-DI we are registering. So let's look at what data is required here then. Here you can see the mandatory data that needs to be put into UDAMED for each UDI-DI. And please understand that this is only the mandatory data to give for each device. Then there is at least equal much data required as applicable. Below this video you find a link to all UDI-DI data that is potentially required. And this document also stipulates the data required for the basic UDI-DI, as I mentioned earlier. In this mandatory list of data you must put into UDAMED for the UDI-DI, you find the EMD encodes that I have been talking quite a bit about earlier. And once again, here you shall assign the most granular EMD encode applicable to that UDI. And the asterisk in this list indicates that this data may not be changed, meaning if there is a need to change this data, a new UDI-DI must be assigned. Maybe some of you now start to think, we have some 200 devices in our portfolio, and all this data is required for each and every device. That's a lot of data and a lot of work. And yeah, you are totally right, it is a lot of data, but there are ways beside manual entering to communicate with UDAMED in more efficient ways. For example, you can upload XML files with the data, and also there is or will be ways for machine-to-machine solutions to facilitate communication when there will be a need to transfer large amount of data. That was about the two first modules for actor registration and device registration. But before we move on, I just want to clarify that when you request to register as an actor in EUDAMED, it is the competent authority in the country you operate that handles the application. And it is up to each country to decide whether this shall be free of charge or comes with an application fee. Just so you know. But luckily, this will only be needed once for each economical operator. All this is specified in Article 28 to 33 and Article 92, but also in Annex 6, plus a bunch of MDCG documents and probably hundreds of unofficial white papers, etc. So just start to dive into it. I hope watching this video helped you understand EUDAMED a bit better. Is there anything you didn't understand or something you'd like to share? Feel free to drop a comment below. I'd love to hear your thoughts. If you like this video, do share it with your friends and your network within the medical device industry. Speaking of network, are you on LinkedIn? If you are, make sure to follow Medical Device HQ on LinkedIn. Thanks for watching once again, and I'm looking forward to seeing you here next time.